There we go. There we go.
I told you we were going to be upstaged. There we go.
There we go.
This is not the end of the show,
No, this
by
is
the way.
there he goes. There he goes.
There we
Tiny,
go.
come around here.
Where'd you come around here?
Come here, Tiny. Come back over here.
We'd like to introduce Karen Moore and Dr. Lance
There he
Lincoln.
is.
They're from, and Tiny here, of course,
Here, Tiny.
a new
Can you go
organization
down
here
on
in
this
town,
one,
CMC Hospice. Tell us what CMC is.
CMC is a hospice organization.
Okay.
It does not stand for anything at this point. It originally was the Community Medical Center of Izzard County,
Okay.
and it was shortened to CMC. So we are now just CMC Hospice.
Okay. And new location? Where you?
We're on 400 South College, right here in Mountain
Okay.
Home, Suite 2.
Now that's by Ponder Drug for people
Yes,
who don't. Yes.
yes, it's in the
Ponder Drug
Suite.
building.
Yes.
I'm big on landmarks. I'm not big on addresses. Well, I'm going to jump the gun here. What? Because Dr. Lincoln, you're here with Tiny, who is your dog,
He's
right?
my dog.
And he's. I saw that you were bringing a therapy dog with you. Well, I
Right.
expected a lap dog.
Most people do.
He
You
is a lap
assured
dog.
me that he is a lap dog, but what role does? Yeah, here we are, people. Look at this. I can see ourselves on here. See, Tiny, this is not your best view here. What role does Tiny play?
Tiny is certified by Therapy Dogs Inc. And as a therapy dog, he's filled multiple roles. I've taken him to nursing homes. They're good with children who maybe have disabilities, etc., handicaps of any kind. But hospice, they have a very nice role in that, you know, someone who's needing comfort. I mean, you can already see it's
He'll take your mind
relaxing
off
and
of
My blood
things.
pressure's
Yeah.
gone down.
Yeah, it lowers your blood pressure. You betcha. Petting that dog, that's the first thing. One of the first things I do when I come home every day is.
And you can tell he craves this, doesn't he?
He craves it. He's very good at it. In fact, this is the first therapy dog I've ever had. I've had a lot of dogs, but when I got him 2 years ago, I saw his personality and thought, boy, he would really be. Once you get beyond the size, he would really be an excellent, wonderful therapy dog.
How does it train a dog? How long does it take to train? a dog to be a therapy
Danes
dog?
are not as easy to train as others. They are not known for brilliance. Cooperation, yes, he'll do anything you want, but they're not known for compared to say a border collie or any of your working class dogs. But I taught him very quickly the things that you need to be a canine good citizen. Sit, stay. Leave it is really important with a therapy dog. You're around places where pills are dropped on floors and this and that. So I taught him leave it very quickly so that if I was someplace and I saw him sniffing something on the floor and I told him to leave it, he would just drop it and not bother with it. But I'm fortunate in him because some of the things that therapy dogs require is you don't want a dog that's going to get angry with other dogs. Quite often you're in places where there's other therapy dogs at the same time. So they need to be able to get along with other dogs, not intimidated by loud noises. Pans drop on the floors in hospice and nursing home facilities and hospitals. And so he's just practically unflappable. We have in the studio today people who
Looks a little different.
would
Yeah.
be terrifying in dim light, and he didn't bat an eye.
Well, is this a new program with hospice then that Dr. Lincoln's just going to help you get started?
Dr. Lincoln is our medical director,
Okay.
but he is also a volunteer with his pet therapy dog.
Well, good for you.
Because volunteers, as we know, is a primary source in hospice, and they play many roles. And because pets are so calming, and so many people have no longer been able to keep their pets at home, or they are too active that they can't have them around, to be able to bring one into the nursing home or into someone's home is often something they crave. They may have had to leave their pet at home if they don't have someone to take care of them. And so this brings a little bit of joy to someone whose life has taken a turn for the worst.
Yeah. Well, it gives them a little distraction too.
Yes.
If nothing else, for a few minutes. That I just never really, like I said, Tiny surprised me when I walked in and saw him sitting on the floor like that, as you can see.
He has advantages because you don't have to bend over to pet him. If you're
That's
in a
what
wheel-
Dan mentioned.
Yeah,
is
if
that
you're in a
you have to bend down and touch
wheelchair,
him.
he just lays his head right in your lap in the wheelchair. So.
Yeah.
The hospice organization that's here now Is it a not-for-profit or?
We
Tell us
are.
about that.
We are actually a for-profit. We are owned by Louisiana Healthcare Group that is for-profit. However, we have a foundation which is non-for-profit.
Okay.
So when you think about that, we have utilized our foundation to help our patients, for instance, exterminate if they didn't have the money for bugs or whatever, to pay water bills, to do things that money gets tight. If you've been sick for a long time, a lot of times folks use all their resources, and so our foundation funds are used to help our families in that, and that is a non-for-profit.
Okay.
I guess we need to give information on how people can contact you if we spark some interest in someone that
Yes.
may want to talk to you about further information.
Our phone number is 424-4000. We are at 400 South College. We have all kinds of things for people if they were interested in doing hospice, volunteering for one thing.
Okay.
In the office or going out and seeing people, 424-4000, they can do that. I don't know how much time we have, but I wanted to mention that
Sure, go ahead.
next month is National Hospice Month. The month of November is National Hospice Month. And hospices across the country are going to be celebrating the lives of all those that they've lost for the past year. And so ours this year will be held in Pineville at the Presbyterian Church at 6 o'clock in the evening. And we're offering it to anyone in the community that has lost a loved one that is on hospice. If you want to come and celebrate and remember your loved one, to give us a call. Let us know so we can put your loved one's name on our list, because we have a program in which we honor and remember each individual that we've lost, each loved one that has gone that past year. That's 6 o'clock, November 4th. That's next Thursday.
Okay. Well, I had something I found out speaking with someone one time about hospice. I was always under the impression, erroneous, I found out, that hospice was for cancer. Since we're talking about this being breast cancer, that's what I thought hospice was for. I thought hospice was for cancer victims, and I found out no. There's no disease specific at all. Hospice is for anyone, correct?
There are several myths that are about hospice. It is that it's just for cancer, and it's not. It's hospice is an organization to bring comfort and help to anybody who is having in the terminal stages of any disease, whether that be heart disease, lung disease, even in just advanced age. Debilitation from a very advanced age is someone who can benefit from hospice. Another big myth is that hospice is just for people in the last few moments or days of their life, and that's not true either. In fact, I think the biggest error people make with hospice is activating it too late.
Yes.
I learned this when my own dad died of cancer several years ago, and my mother was so resistant to having hospice. And
because I feel like they're giving up if they
it is.
contact
It's almost
hospice.
like a giving up, and but there is a point when it's clear that all has been tried, and what we need is some assistance and some help and some comfort. And hospice is so multidimensional; it takes care of the physical aspects. We also offer assistance with social and spiritual aspects. And even though I had been ordering hospice for years for people, she was on the other foot now, and I was seeing hospice from the inside, and they were so beneficial to my dad and my mother. I realized even I was probably ordering hospice too late for people, that I should be ordering it much more earlier.
Yeah, because I know people come, like they go to hospice houses and they come in and out. When I thought, really? I mean, I always thought that was just someplace you went at the very end. And they were like, oh no, you can get better, you come back home. And so there's all kinds of helping facilities. Now, does someone have to, like Dr. Lincoln's a physician, would he have to direct me to you, or can I come to you without a physician's referral?
Anyone can call a hospice and say, I think I need your services. And at that time, we take down who the person is, what their age is, what they have wrong with them. Then we contact your physician.
Okay.
And we say, we've had a call from a family member or the patient, and they're wanting to go on hospice. You know, the interesting thing is that people, no offense, Dr. Lincoln, think that doctors whatever a doctor says they have to absolutely follow. But the truth of the matter is, each individual person can say, I choose not to take that treatment. I don't want to be sick. I would rather have 6 months of quality of life without the pain of whatever, if that's what you're telling me I have, than to be deathly ill and live a year. And so we can say, you know what, what's my percentages? Are my percentages really high? Maybe I'll think about treatment for whatever. But that Medicare states you have prognosed 6 months or less to live. Okay, as the disease
For
process,
hospice
as we
to kick
know
in?
it, to get on hospice. That's what they say. However, you do 2 90-day research, which gets you up to your 6 months, and then you have an unlimited number of 60-day recertifications as long as you meet the criteria that Medicare sets up. And Medicare's criteria is very specific, and all the hospice across the United States follow the same criteria. And that's the truth.
But as Dr. Lincoln pointed out, it's spiritual guidance, it's
Yes.
physical guidance, it's social, and you even give like financial tips as far as like you might
Yes.
getting your papers in order,
Yes.
Yeah.
different things like
Yes.
that, all the things you don't want to confront.
Funeral,
but
assistance with the funeral,
assistance.
ways to help pay for things.
And that's where volunteers can come in. Sometimes,
so much.
you know, somebody just needs, I need to go get groceries. I need somebody just to sit at home with my ill spouse or my ill mother, or well, I go get groceries, and that's where a volunteer can come in. Or cleaning a home. What a wonderful gesture for someone that's sitting with an ill spouse, you know, to come in and clean their home, or
Reading
cook
the
them a
newspaper.
dinner. Read the newspaper.
Read the newspaper to them, things like that.
A lot of services.
There is
mean-
also the bereavement that follows afterwards, which is the service that we're having next week.
Okay.
The bereavement follows 13 months after the loss of your loved one. And people say that some folks say, I don't want it, and that's their right. And some say the information we get, the phone calls that we receive, is very helpful. So it's for the family, and it is for the patient.
Again, your phone number,
424-4000.
4,000.
Yeah.
And you're located 400.
400 South College,
South
Suite
College.
2.
Yep.
Okay.
In the Ponder Building. For
In
those
the
people who don't know.
Ponder
In the
Building.
Ponder Building for the people who don't know.
Thanks so much for coming by, and thanks for
It
bringing
was
Tiny.
nice to meet
You
you.
betcha.
Tiny.
Thank you for having us.
He was
Thank
a
you for
pleasure.
having us.
All right, thanks
He's
so
a little
much.
hyper.
Oh yeah, he's a liar.
Yeah, he's a little hyper. Up next,
Yeah.
we're going to be talking with Rich Kluk, and he's a dinosaur builder, and I'm interested to know all about what he does. Stay with us.